Africa's understanding of HIV and TB, the Human Sciences Research Council has conducted a study looking at the health of educators in public schools on behalf of the Department of Basic Education. A short while ago, the Department and HSRC released results of their study, which has been conducted in over 1,000 public schools nationwide. The study looks at the status of HIV and AIDS and other communicable diseases in the public education system. Now, to unpack this further, we are joined by the Executive Director at HSRC, Professor Khangelani Zuma, from our Durban studio. Prof. Zuma, thank you so much for joining us this evening. Now, before we get into the details about the findings of the study, take me through the thinking behind it.
Well, this is a study that was, which is a follow-up on the survey that was done in 2004, which was commissioned by Education Labour Relations Council in 2004, conducted by Human Sciences Research Council. And this was the first ever study on the health of educators to be done in the country, to look at HIV and other issues related to the health of educators, looking at the well-being of educators, issues that are increasing their job stress, and many other issues that are associated with the health and the class sizes at school. So a number of interventions were put in place by the state as well as the unions, teacher unions, to put programs to deal with to mitigate against high levels of HIV infection among educators. So this 2015-16 study is a follow-up on that.
Now, Prof, before we get into some of the technicalities behind the study, let's look at why you only did the study for public schools. Does this mean that the HIV is more prevalent in public schools, or is it a case of public schools being more than private schools, for example?
Well, we are guided by the availability of funding. The funding was provided to the Department of Basic Education, and therefore we concentrated in those schools, but it does not mean that HIV is only among public schools. Everyone who lives in the country is at risk of HIV infection, irrespective of where we work.
Now, Prof, the crux of the study was to look at how the health of educators contribute to the quality of education in public schools. What else did you find out that stood out specifically in the study?
It's the slightly increased levels of HIV infection in 2015, which increased from 12.7% in 2004 to 15.3% in 2015, and also the higher levels of other non-communicable diseases such as high blood pressure reported by educators to be at about 22%, and 10% of educators reporting to have been diagnosed with TB. However, the slightly increased levels of HIV, we need to interpret that in the context of two issues. That's the HIV incidence, that is the level at which teachers recently got infected with HIV, and also the presence of antiretroviral treatment, which has made sure that we reduce the AIDS-related mortality. And therefore, the increase in the HIV prevalence that we see now could be, for example, the more educators living longer now because of access to ARVs, and also educators still getting infected with HIV, whereby we found that per year, a total of 2,900 educators recently got infected with HIV. And this actually translates to about 8 educators getting infected with HIV every day. And this is concerning to us, given the fact that educators are people who are educated, who are there to impact knowledge, and who should know about how to prevent HIV. However, we're still getting them getting infected with HIV, and those are some of the issues that we need to deal with, and also issues related to job stress and workload, which is associated with absenteeism at school, which could be due to HIV-related illnesses, but also the increased workload due to class sizes that have been identified to have increased, identified by educators.
Now, Prof, we've spoken a lot and extensively about the issues around HIV and AIDS and how the numbers have shifted and increased compared to the study you did in 2004. Something that jumped out as well within your study is the fact that in terms of other factors that influence the health of educators, things like work dissatisfaction and work overload are also included in this study. Let's look at that and what it means for educators in the public system.
Well, the increased workload, these are factors that affect the quality of education. As you would know that teaching in a large classroom, for example, so many learners, the level which you can personalize that contact with the learner is completely different when you're teaching in a classroom that has got quite a reasonable number of learners that are easily manageable. And issues those are issues that affect the quality of education that is presented. And that has been cited by educators to actually increase their stress levels. However, I need to emphasize that these issues, especially workload and stress levels and intention to leave the profession, has actually decreased compared to what we had in 2005. For example, in 2005, 55% of educators indicated that they intended to leave the profession. And that has gone slightly down now to about 35% of educators intending to leave the profession. And issues around salaries and also workload, those are the main issues that were cited as the leading causes of wanting to leave the profession.
Now, Prof, within the school curriculum, there are subjects like life orientation where teachers are tasked with teaching their pupils about HIV and AIDS and other communicable diseases, as well as healthy lifestyles in general. Now, based on the results of this study, are teachers in public schools equipped enough to understand the HIV and TB epidemic in such a way that they are able to articulate it to their pupils?
One of the big challenges that we have as a society, if we look at the knowledge, the results in the report show that the high levels of knowledge among educators, way over 90%, as to how to prevent HIV and also issues around stigma. They correctly point out that the educators are less stigmatizing towards people living with HIV now. However, the challenge of the society is that hardly that knowledge translates to actions. So that is the problem that we face at the moment, that there is quite high levels of knowledge, but for that to translate into actions, it is the challenge that we face at the moment. And there is a lot of work that we need to do to deal with those issues, ensuring that we impart knowledge and we convey the right knowledge to the society, to the learners, for example. But of course, teachers are exposed to training. A number of educators have indicated that they continue to attend a number of trainings whilst they are in the teaching profession.
Prof, let's look at the geographic spread of the HIV prevalence among educators. Are there any provinces that are making more strides in terms of dealing with HIV compared to others?
In 2004 and also now, KwaZulu-Natal had the highest level of HIV infection. And in 2004 it was KwaZulu-Natal, Eastern Cape and Mpumalanga. This time around, it's KwaZulu-Natal, Mpumalanga, Eastern Cape that are leading in terms of HIV, high levels of HIV infection. But then again, we need to remember, like I said earlier on, that interpreting the prevalence of HIV, we need to interpret it in the context that the more people are on ARVs, people live longer, and therefore we reduce mortality. However, if we still have people getting infected, the increase in HIV prevalence could be due to new HIV infection, which is the case, as well as people living longer. However, provinces such as KwaZulu-Natal and Eastern Cape still have high levels of HIV incidence. That is many educators, like I indicated, about 2,900 of them getting infected recently as within the last year, getting infected with HIV. So those are concerning. However, Western Cape, which has the lowest levels of HIV prevalence at the moment, one of the biggest concerns is that it's the province that has the highest increase in HIV prevalence when you look at 2005 compared to 2016. So even though it has the lowest HIV prevalence, but it is increasing from year to year. So that is a concern, and that is what we also need to attend to.
Prof, what sort of interventions are you recommending to address some of the issues raised in your study?
It's a number of issues that we really need to address. It's factors that are addressing social and behavioral change interventions, ensuring or encouraging, promoting condom use, for example, consistent condom use that we need to encourage, and also easy access to other prevention methods, such as access to places where you can easily find condoms, and reduction in multiple sexual partnerships. So those are issues that we need to address.
Prof, we'll have to leave it there. Thank you so much for joining us on SABC News. That was the Executive Director at the HSRC, Professor Khangelani Zuma, joining us live from our studios in Durban. More news coming up after the break.